Good morning and welcome to TAO's first session of our final day of Impact for 2021. We've created Impact as a year-long series of conversations and online content supporting our efforts to engage with the community on several themes, which include economic competitiveness, talent and culture, and also digital transformation and innovation. I'm Skip Newberry, President and CEO of TAO, and I'm excited to kick off our first program on digital transformation and innovation with a conversation between Eric Turner and Gary Daniels. Today, I'm joined by Riley O'Brien, who's the Vice President of Events and Experiences at TAO. A couple of reminders before we start. All participants have been muted. Please remain on mute unless a TAO staff member unmutes you and calls on you to talk. You may ask or respond to questions in the chat box publicly or privately by directing your message to Riley under the name TAO Events Team. We'll monitor the chat box and respond throughout the discussion. We also ask you to please utilize the participant icons on your screen throughout the program. And of course, we love folks to engage with us on social media during today's call and throughout the day. And we appreciate all the support. You can see where to find us on the slide. Due to the limited time, we'll capture all questions in the chat, and any questions we don't get to, we'll make sure to get answered later in our online member engagement platform, which is called Mobilize. So Mobilize is TAO's member-only virtual community, and our guests will provide written responses there to any unanswered questions from our event. If you have any questions about Mobilize or joining TAO, please reach out to membership@techoregon.org. And a huge thank you to JLL for underwriting the series. We appreciate their sponsorship and support. We invite you to join us at 11:30 a.m. today for our panel with digital transformation specialists, and at 2 p.m. for a Q&A with regional sports groups on their digital transformation journeys. Now it's my pleasure to introduce Managing Director at JLL, Eric Turner, and CEO of UnitedHealthcare, Gary Daniels.
Hey, Skip. Well, as you mentioned, I'm Eric Turner, Managing Director of JLL. It's my pleasure here to introduce Gary Daniels of UnitedHealthcare, and I think we'll jump right into it if that's okay. Gary, do you want to give a quick introduction of yourself?
Yeah, sure. So first of all, I really appreciate the time and the opportunity from TAO to be here this morning. A little bit about myself, fifth generation Oregonian. I'm the CEO for the Pacific Northwest, which encompasses Oregon, Washington, Montana, Alaska, and Hawaii. And basically what that means is I work on behalf of all of our commercial customers, so employers, our government relationships, procurement on behalf of employees and individuals in individual space across the majority of those states. So again, I'm really excited about being here and look forward to the Q&A.
Thank you. And I love the fifth generation Oregonian statement. I'm a second generation Oregonian, and it's interesting. You start trying to do the math a little bit, but welcome. And I'm really happy to be here with you today. So also as we're a customer. So we're a customer of UnitedHealthcare and do a great job across all of JLL. We're also Optum as well, which I think we'll probably get into. So can you tell us a little bit about the core strategy for UnitedHealthcare and how your markets are changing?
Yeah, so I think before we jump into just the strategy question, I get lots of questions around what the heck's the difference between UnitedHealthcare and UnitedHealth Group, which is our umbrella organization. So I thought I would just take one quick step back, because I think that the understanding the combination of our enterprise is really important to understanding what our core strategy is as an independent business and how it kind of works within the healthcare space. So UnitedHealth Group is the parent company, and really UnitedHealth Group, and that's who you see as publicly traded, is really split into two distinct businesses. And in one umbrella, we have, underneath that umbrella, we have UnitedHealthcare, which is what I sit in. And I obviously run our employer and individual business within UnitedHealthcare. We also have our Medicare business, and we also have our Medicaid business under that same silo there. On the other side of the house, under UnitedHealth Group, we have our rapidly growing Optum business. And Optum is made up of Optum Care, which is the largest primary care multi-specialty footprint in the entire country. You're probably starting to hear some of those acquisitions happening in the state of Oregon. We've had several over the last couple of years. We've had several in the state of Washington. Optum also does things like behavioral health. They have a very large PBM business, so prescription drug business. But they also have what we refer to as Optum Insight, as well as Optum Analytics. They do a lot of what I would say is the big macro data informatics information that drives a lot of our enterprise decision making. In total, across both of those businesses, we employ about 340,000 people. And I think, and I should probably know the answer because we just had our investor conference this week, but I think that we're supposed to deliver something like $320 billion in 2022. And the majority of that, interestingly enough, is really shifting and starting to come through the Optum side of the house, which is growing very rapidly as they focus on healthcare delivery and more of the consumer experience. And so with that very large organization comes very large and grandiose and really important goals. And our mission is it's really to help people live healthier lives and make the system work better for everyone. And there's not a lot of organizations that can kind of have that grandiose goal of making the system work better. But the reality is across our enterprise, we touch 140 million Americans across our distinct businesses under the UnitedHealth Group umbrella. And so we're really passionate about our ability to deliver that change. And if you think about the course of our business going back several years, back to 2011, we feel we're on the right path to being able to execute that. So that's just a little bit of background. I think that I hope settles in terms of the differences within the organization and kind of where I fit into that. But specifically around your question, what is our core strategy? And I'll give you the UHG core strategy from my perspective, because I think it's really important as it's driving all the individual businesses. It's to create a better consumer experience. What we do in terms of health insurance is way too expensive. It is incredibly complex. It is filled with ambiguity in terms of is your prescription going to be covered or not be covered? Is my claim going to be covered or not be covered? That is not the environment in which healthcare should operate. And so both the goals of the enterprise, when you think about the individual business with UnitedHealthcare and Optum, is to really create an end-to-end consumer experience where they want to do business with us as an individual consumer. And they feel like when they work with UnitedHealth Group, that we truly understand where they're at as a consumer and that we can be the end-to-end solution for them as they go down their healthcare journey. Interestingly enough, I got to listen to like an example of what that looks like. And I find it fascinating, especially probably more so for you and the tech community. But we obviously we all have our smartphones on us 24/7 these days. And what an end-to-end consumer experience we think could look like and can look like, and it's rapidly going down this path, is that you can either call in and do a face-to-face with your doctor, or you can set an appointment on your phone. You don't need to call and schedule an appointment, that the technology is routed into the doctor's scheduling practice. So you can schedule real time. That when you walk into your doctor's office, that because we've done geofencing using your technology again, that when you walk into your doctor's office, they already know who you're there. They already know why you're there. You don't need to check in with them. You don't have to, you just walk in and you're able to see your physician if that's the experience that you want. That when you leave your doctor's office, that you don't have to worry about, is my drug covered? Because it's covered 100% of the time, because the right technology links what we cover as a health insurance company with the physician and the way that they prescribe care to that individual member. And then for the really complex services, when you unfortunately either have to have a surgery or choose to have a surgery, that if you go through that entire continuum, that you do a lot of your follow-up care and your recovery at the home. And we have the scale and ability to actually take care of you in your home, because especially when learning through the pandemic, is that we can do that really, really well, and people actually recover a lot quicker in a lot of scenarios. And so being able to provide that end-to-end through care delivery within all of our businesses is the core strategy. It is purely focused on the consumer. And the journey that we have to go through to get there with digital transformation and everything else is what's going to be our big challenge. So
that's great. So you talked about the user experience and the end-to-end experience as you're changing strategy and addressing that, but you also mentioned that healthcare is too expensive, and I would agree with that. How is this impacting the cost of healthcare, or is it, with your strategy?
Yeah, it's, and I could have a really long discussion about the cost of healthcare, but what I would tell you is that there's got to be value. There's also got to be value. It's not just about the cost. It's about when people pay their premiums, they feel like they're not getting value out of it, right? They still don't know if they go and see that doctor, is their prescription code to be covered, or if their services are going to be covered, or if they have to deal with a prior authorization. A lot of what we're trying to build in with our digital transformation is really rooted in how do we eliminate all of those negative interactions, so that when people do pay for a service, they feel like they're getting value, that they paid a premium, they got what they expected to get, they had a high quality outcome, they knew the quality of the provider, and they feel like when they had the expensive surgery or they have the prescription that they have to take, that they're getting value for what they're paying for.
Got it. Yeah, that's great. In terms of technology, you talked about the smartphone and the end-to-end and some of the things that you're doing. Can you describe how the company is approaching technology for the group here? Are you developing it in-house? Are you making acquisitions? What's the strategy behind that?
It's all a little bit. So it's a little bit of everything. It's interesting when people ask me, well, I think I made this comment, it may have been at the Tech Awards, around the fact that we are a technology company. We are a tech company. Obviously, we provide health insurance, we provide healthcare, but the baseline in which we're able to do all of that stuff is rooted in technology. From the millions of claims that we pay every single week digitally, to the experiences now that we have with our phones, in the sense that you can either do a FaceTime with your doc, or you can go see your doctor. All of those experiences, the electronic medical records, all of that stuff happens with a digital backbone. And so a lot of our transformation now is really, what I would tell you, is rooted in kind of two distinct pillars around digital. One is having a foundational digital strategy. What I mean by that is the big macro thing. So how we pay claims is done right. How we engage with providers and capturing data through their electronic medical records, so we don't have to do silly things like prior authorization. We just know that the provider is doing the right thing every time because we have the right connectivity with them. Those are big macro digital transformations that we are going through right now as an organization. And then what I would say is kind of on the tip of the spear, the cutting edge digital transformations around things like virtual visits, where we can engage with our doctor over the phone, or we can text chat. All of those types, I'd say, are really kind of more of the cutting edge opportunities of healthcare that we are micro focused on as an organization. So our investments kind of teeter between the two, but I would tell you it's kind of split between making sure that we shore up our foundation so that we can meet this future consumer need, as well as creating the cutting edge technology where the consumer wants to be right now. So it's definitely an interesting time for us.
It is, and it's an interesting time in the healthcare business as well. I mean, I think we have this opportunity, like you said, to really transform the healthcare industry and hopefully make it more efficient and more valuable to the end consumer, which is the people. My question is, there are so many providers and hospital systems and doctors, and how do you get all those, or where do you see it going? And do you see, it seems like there are some leaders, maybe UnitedHealthcare is one of them, and then also other hospital systems that might be leaders in terms of becoming more digital and becoming more technology focused. do they work well together, or how do they all interact in a way that makes sense?
I don't know if I have a right answer for that. No, it's a challenge. I would tell you, we're going through from a purely a health insurance and healthcare perspective, there is a massive transformation happening right now. One of those transformations is around transparency. There's a lot of legislation that's happening, which I think is fantastic around transparency. I would tell you that the thing that I'm proud of at UnitedHealthcare is that we've had the longest running transparency program in the country. That when you're a member at UnitedHealthcare, you can search for roughly 80+% of all claims and know exactly what your copay is, what your deductible is going to be, how much that individual provider is going to cost. But the problem is, if you leave UnitedHealthcare and go to somebody else the next year, those costs all change and the dynamic completely changes. So I think a level of transparency is still very much needed. I would also tell you that as the federal government continues to change and to push, the government business and Medicare and Medicaid into alternative settings, so making sure that people have surgeries at the right outpatient settings versus having it in inpatient hospitals. From a legislative perspective, there's a massive push through the government business. And so what we're seeing is that the hospitals are really responding to that, and they're building the right pipes and the right technology to, quite honestly, push in their own systems bodies out of the hospital beds and into outpatient surgical centers, and really not just pushing them out, but having the right care setting that aligns to the right cost is really important. And so we see hospitals that are starting to grow and buy into that type of a system. So we're excited about what the opportunity can be. Now, how we get from what is the opportunity to actually getting there is two very different things that's rooted in some very complex business discussions. But what I would tell you is, especially in the state of Oregon and especially in the state of Washington, there's a lot of very forward-thinking leadership around what healthcare could be. That healthcare should be driven by the primary care physician. It should be rooted in making sure we support people with mental behavioral health issues, and we have the right networks and we have the right constructs to meet our constituents where they need to be. So I'm really excited specifically around Oregon and Washington's ability to deliver over the next several years in a much better system in these communities. So.
Thank you. That's helpful. You mentioned behavioral health a couple of times. Can you speak a little bit to that? Because it seems, at least we're feeling some of the impacts of mental health, behavioral health, whatever you want to call it, in Portland for sure. But you mentioned that as a priority. Do you want to expand on that at all?
Yeah, I mean, it's, especially through the pandemic, it has completely changed. We knew we had a issue with mental behavioral health, access and network and payment prior to the pandemic. And I think I said there was a crack in the beginning. It is a full gaping Grand Canyon right now in terms of how we support that need, especially since the need is growing so dramatically so much. I think we've made some really good strides. We did payment parity to really make sure that we were paying providers in the right way for those types of services. The one thing that we really saw that was helpful, again, going back to the technology piece, is that we could actually meet members where they wanted to be. I jokingly tell people that where I grew up out in the sticks in rural Oregon, that if you wanted to have a behavioral health visit, if you had to go see a therapist, you probably had to drive, an hour or two at least. And if you wanted to engage with somebody up in the Portland metro, good luck. What the changes around payment parity, and as we've been able as a state and a government to expand Wi-Fi and expand internet, it gave us the capability to say, okay, now we can take care of you in a more meaningful way. You can still have the right interactions with your behavioral health specialist. You don't have to worry about, we talk a lot about things like social determinants of health. A part of social determinants of health and what drives the disadvantages there are things like transportation and being able to have the ability to access the higher quality physicians. Some of that work happens with the technology changes. Some of that work happens with the infrastructure changes from a government perspective to be able to supply internet to communities that historically didn't have it. So I think we're getting to a better place. We still have a long ways to go, but it's not going to be just the health insurance company. It's going to be the digital infrastructure that's built. It's going to be the reform that has to happen in terms of the way that we pay for these providers. And I think we'll get there, but it did open a lot of eyes that we had a serious problem that we're starting to make some serious changes too. So.
Well, so you're in a large organization. I think you said what, 340,000 people, something like that. Big organization. JLL also is a big organization. We have 90,000. We, I think, view ourselves as a tech real estate company as well, and we design sometimes our own technology, and sometimes we acquire other groups. But certainly with a large organization, it's hard to make massive changes across silos and or divisions and geographies and whatnot. Do you have any comment on how you navigate that as an organization?
Yeah, so I think part of it's quite honestly is rooted in the DNA of United Health Group. So United Health Group was a bunch of acquisitions. I mean, the reason why UnitedHealthcare in Oregon really exists is because of the acquisition of Pacific Care. And that was done through the entire enterprise. Optum RX is who they are because of several PBM acquisitions. Optum Care, same thing. It was acquisition based. I think the real genius behind what the enterprise does is there's a couple things that stand out to me. One is that we're a local market up. I used to tell people when I joined the organization about 12 years ago, I felt like Minnesota, where we're headquartered corporately, like the instructions were beamed down from the mothership in terms of like how you should act and the way you should contract and the products we sell and what we do. And we went through a massive, what I would say was a local market transformation where all the decisions we make around how we contract, who we contract with, is done as a local level and a local leadership team. And that really led a much different, I would tell you, kind of innovation set that boiled up from kind of the local markets up into the organization. And over the last, several, I'd say 6 to 7 years, this meshing between what happens at a local level that's really important to the constituents here in Oregon, it's important to how we build our products, what we sell, the whole 9 yards, that I think flex up to the national organization and the flex down from the national organization to us in terms of capital, in terms of thought leadership, in terms of that cutting edge thinking that we should be doing at a local level, but we necessarily don't have the capability to because we're trying to just run our businesses here. Makes us really unique in terms of being able to both grow with an eye towards the future as well as the demand of meeting our customers today where they need to be met. And I also, just one other thing I would say is we do, this whole idea of buy versus build. I was thinking about this last night. I don't necessarily think it's a buy versus build. I would tell you for us, it's buy, build, and a ton of pilots. I think we do probably more pilots than any organization that I've been engaged with. We take a ton of small bets. All of those small bets really come out of the local market. And it's things that we go to every year. We do a business plan. I go and I try to fight my peers for a lot of capital and say all these great things I can do and build at a local level. And they buy off on them, and we tinker and we try to grow them. And if we prove that we can be successful, the enterprise gets behind us in a way that is really pretty magical when you think about an organization with the size and scale to say, we love that local, what the local team created there. We want to get behind it. We want to build it. We want to scale it. And then all of a sudden it becomes a big part of our business as an enterprise. So I think it's a kind of a combination of all three, not necessarily the buy or build.
Definitely. We're the same in our company as well in terms of some build, some buy, some, like you said, pilot, which is wonderful. I think there's a lot of folks on the line who are technology folks, entrepreneurs, innovators, and you think about the healthcare space and you think about digital transformation. where do you think it's headed? Where do you think you could point folks in the direction of adding value for the end consumer if we were going to create something, or if you were going to contribute to what UnitedHealthcare is doing? I just feel like there's a lot of open-ended innovation that could be built for the healthcare system, regardless of if it's insurance or hospital systems, et cetera. But where do you see it going?
Oh man. So I guess a couple comments, more than where I see it going, I guess is a better way to say it. But first is, if you look at the IPO market this year, I think there was 25 plus health related companies that want an IPO this year. It's somewhere in that range. Not to a lot of success. Some had varying success. Some jumped up because they were focused purely on telehealth, and we kind of see the telehealth spike, and then it went back down again as more people got back into the seeing their providers face to face. And we also seen the last couple of years a lot of what I always say would be like niche or very point solutions that were focused on a specific problem. And large organizations like United Health Group are continuously investing. I think we have a part of Optum is Optum Ventures. They have a portfolio of $600–700 million, about 50 cutting edge companies, and they're just watching them. Like they're watching them, figuring how they could fit into our umbrella, how they would change healthcare. Some of the stuff they do is so advanced that it kind of blows my mind. But we have the part of our enterprise that watches that type of stuff. And the way that we think about it is not the point solution, it's how the point solution fits into the continuum of that consumer experience. And I think far too often what we've seen is a lot of really cool point solutions come out. They fit a niche, they get a lot of excitement, but then the large organizations like United Health Group that was working on the same stuff, we can fit that point solution or the goal of that point solution into the continuum for the consumer experience in a very seamless way. And then that point solution kind of gets dried up to a degree. And so what I tell people that are thinking about either creating a solution or a business, think about where it fits into the continuum of healthcare, not just the solution and what you're trying to answer a question to or the business problem you're trying to fix with whatever you're delivering and developing. Think about how it fits into the continuum of healthcare, because that's where large organizations like United Healthcare and United Health Group really want to focus. They want to be able to take those solutions, put them into the system so they can continue to improve that consumer and employer purchasing experience.
Excellent, thank you. I want to open it up, Skip and Riley, if there are questions in the chat that you could ask that are relevant for Gary, I'll give you an opportunity to do that now. Well, I don't hear them, so I can keep going.
We did have a couple questions come in. The first was, Gary, you talked about value for the cost of healthcare. Are you working prevention into that value, and how are you integrating technology into that prevention work?
Yeah, prevention is absolutely critical. And prevention isn't just about I think we think about prevention in a lot of different ways. I would tell you, we've done a lot of interesting stuff that I think combines prevention with what we hope and feel is a big consumer value. And I'll give you one example. So we have pretty much as a standard now with our HSA, so our high deductible health plans that are sold with an HSA, we have a product called Motion. And basically it's where if you wear your Apple Watch or you connect to your phone through this partnership with Apple, that is depending on how much you walk every day. We now have swimming, we now have all these exercises you can do. You get money put back into your HSA. And so again, we know that it's not just a prevention, but it's a combination of a prevention and a positive reinforcement, because that's one thing I think we lack sometimes with these prevention talks is people want positive reinforcement that they know is driving the right, that's driving the right experience with their engagement in health. And what we were learning is those types of programs really help us to not just bring prevention forward, but it creates the right type of routine that hopefully continues a focus on prevention and lowering cost and engagement, and quite honestly, for people to understand and engage in their health in a meaningful way is a challenge. And so we're finding that those tools really, really help us. And what was the second half of the question?
Is how are you integrating that technology into that prevention work?
Yeah, so in that example, it's completely integrated into your phone. It's integrated into your watch if that's the experience you want. And we continue to test a lot of those. We have I would tell you it started off as probably the worst named program in history. It was called and this was several years ago, it was called the Diabetes Prevention Program. And you can imagine how many people wanted to be in a program that we refer to as the Diabetes Prevention Program. But the program itself was rooted in amazing clinical data around not just working out, but how you eat, how you actually buy groceries, how you cook for your family. Do you have the right income to be able to do things differently? And if you don't have that, how can we help you find things like coupons and ways to save money? And so what we actually did with that program, because again, it was fantastic from a clinical perspective, horrible from a naming and marketing perspective, is that we worked with the former Beachbodies guy that started Beachbodies, and we completely rebranded that program. We refocused it around healthy eating. We actually sent out things like food scales and all kinds of different cool stuff that would help with people in terms of how they shop for food, how they cook for their family, right portions. All of that type of engagement was actually changed pretty dramatically. It became one of our most successful programs at UHC, solely focused on prevention. And really the only thing that we did is we changed the naming and approach, because it wasn't focused on what consumers wanted to be engaged in. So again, I think that's going back to the pilot and the tinkering, and I think the ingenuity of our organization is that when we know things are really important and it can really help people, how do we get it to them in the right way? And in that scenario, we just had to change the way we deliver the product.
Thank you. Hold on, I'm opening up my spreadsheet. There's another question here. It's a little bit bigger question. So you mentioned the increase in telehealth and other technologies in sports healthcare. Where are you at with integrating evidence-based innovation treatments to address access to care, social determinants of health, and lack of PCPs or mental health providers? And they gave examples of web, app, or smart speaker-based services for smoking cessation, maternal mental health, substance abuse, perinatal, postpartum, grief, etc.
Yeah, that's a heavy question.
Yeah.
And I could probably provide more offline, but what I would tell you, and I'll just hit on, you mentioned one set of comments there around social determinants of health. And I think, I know for a fact, obviously that's, there's been a lot of discussion around what is social determinants of health, how do you get after it? And I would tell you that we've been very aggressive in that space. And what I mean by that is, for our larger employers, we actually can run a series of reports that can tell us exactly where an employer needs to focus if they have a population in a specific geography where we think that they have an issue with social determinants of health. So we can look at things like food status. We actually have a reference to what we refer to as things like food swamps. And what that would be is areas where you have an employee base or a population base where they don't have access to high quality food. We can also tell through these same tools and analytics the amount of employees that could have transportation issues because they work or they live too far away from their employer, and the cost is either too high for them to get there, or it could create issues for them because they have to take public transportation. And all that weighs on, obviously, not just their ability to work for their employer, but their ability to even get to care. Similarly with just food access in general. I mean, in some of these scenarios, when we run these reports and have a discussion around disparities with an employee population, we've made recommendations, not just doing things like on-site, near-site clinics, but you should really have a food pantry, and you should have a process in which people could probably pick up food at your location as an employer, because you have so many low-wage employees that are traveling very long distances. And we don't think that, based on what we see and what we see in their claims and what we see in the information, that they're probably getting the right access to food in which the way that they should. And then obviously you weave in the bigger items like mental behavioral health access, and you name it. I think I may have mentioned this at the, I think Skip told me this is the reason why everyone wanted to chat with me again. Pre-pandemic, only about, I think the number was like 4 to 5% of all of our behavioral health visits were done virtually. Now that number is around 63, 64% of all of our behavioral health visits are done virtually. And so that's an amazing growth. That's an amazing achievement. And we think that, again, as the government continues to support, which I know Skip and you guys continue to push for, expanding internet access, expanding into the rural areas, giving communities a better opportunity to take advantage of the technology that will, again, give them better access to care, is going to be really, really important. So it's a combination of all these really complex structures and needs. But I think as an industry, I think as governments work together, I think we're starting to get how all of these pieces work together. Again, this continuum of care versus trying to fix one specific issue or one specific problem. I think as we continue to do things through the social determinants of health view, is really going to help us get after some of those bigger items.
That's great. Folks don't have to be shy. You can ask questions in the chat. I've been getting a lot of questions on the back end of things. But one of the questions is, given that digitally expanded world and ability to interact, have you entered into any unique partnerships to better serve the healthcare needs of your customers?
Oh yeah, we have a ton. The best example I can give you is on the behavioral health side. So we work with, we have Sunvelo. I think there's probably 10-ish different behavioral health organizations that we work with, that's fed in through our apps and our populations have access to. And I've had discussions with employers and others that say, wait a minute, this is too many. Like, we just want one. Just give us one, because we have too many. And what I've explained, and the reason why we've done this as an enterprise, is really twofold. One, especially when it comes to mental behavioral health, people interact so differently. And we've learned really quickly the interactions are really dynamic. We have young populations that only want to text. Like this 18 to 29-year-old will get on there and they have no problem texting their feelings in these really massive long streams, and they're perfectly fine with it. They don't want to do the web, they don't want to visit in person, but they want to be able to get their feelings out and interact in that type of way. And so we have tools that meet that population. We have other populations that want to do the FaceTime visit. We have other populations that want substance abuse support, but they don't want to do face-to-face, and they really want to do it on their own. And so what we've found is that integrating, again, these point solutions into our tools to where they feel like they're a part of a continuum versus just, having one solution or just a point solution has been really important. And we're just now starting to understand what that means. I also did a presentation, it was like 2 weeks ago. And one of the things I brought up in the presentation is, when you think about all these new entrances, we have Amazon Care, we have all these organizations, these telehealth organizations, 51% of the 18 to 29-year-olds feel like that's healthcare. These new innovative technology-driven solutions where they don't go into a doctor, they're usually pretty healthy, they think that's healthcare. And as they age, what are we doing as an organization, as a system, that if that's the way that they want to engage in care and that's the way that they feel comfortable, how do we make sure that we create the right interaction, the right pipeline and the right experience for that group of individuals that will continue to age into needing more care, knowing that that's the way that they want to engage with us as an organization. So it's a very dynamic time.
No kidding. That's great. Thank you for that. One question on patient information and privacy, and you're partnering with third-party companies like Apple, you mentioned. Do you need consent from the patients that keeps, or from any of the data that your firm keeps, or how does that work? Can you comment on data privacy?
Yeah, privacy is like the number one priority outside. I mean, it's got to be how we protect health information. I would tell you, we do it extremely well. It is always top of mind, not just from how we engage from like just a purely healthcare perspective, but I would tell you even the way my teams and staff operate, like there's no paper around here. Everything has to be secure and VPN'd in. There's no third-party access to internet within our computers and kind of default settings. We take security very seriously, and everything that we build in terms of these third-party relationships or user engagements are always done with making sure we comply in those areas.
Yeah, there's a follow-on to that we got from a different person, just basically saying, as we go through the transformation, the digital transformation with personal health data, combine that with the general distrust of the government and corporations by a fairly significant portion of the population. How bumpy do you think this transition will be, and what do you see, if any, challenges ahead? How big do you think the challenges would be?
Yeah, I mean, look, I think the really important thing, and especially when it comes to healthcare, right? This is, you think about if you have a child that's got cancer, or yourself is sick, or a family member sick, those are literally the most dramatic times of your life, right? We've had a lot of people that have been impacted by COVID. It's really scary stuff when you think about the end game of what we do is to make sure people get access to high quality care and they can take care of their families and kind of alleviate that stress in real time. But to your point, in the sense of, how do we make sure that we continue to do that really good work, but we continue this digital transformation? I think that goes back to my original comments, is that every consumer views value differently, and every one of them wants a different experience. And I think probably more so in their healthcare than what they do with, accessing a digital platform, be it Facebook or Instagram or whatever it is. Like it is a serious discussion when we think about healthcare. And so we have to have solutions that fits this end-to-end continuum, but allows people to access the way they feel most comfortable. And so a lot of what we're doing today, I'll give you one example with Optum Care. So our Optum Care, the way we're building our technology with that organization is to say, if you want to do a FaceTime visit with your doc, you can do that if that's the way you're comfortable. If you want to go in and see them, you can schedule it and you can go in and see them, because we know that there's a lot of people that just want to be able to go in and see their doctor versus trying to do a FaceTime with them. And so making sure that we can meet our consumer where they're at is going to be really, really important. And I think it's more so important for healthcare than probably any other digital interaction that we have.
There's a follow-up to that, Gary. Is one of the questions was, what does the future of healthcare look like for populations which are less tech savvy? I know my parents in particular, we kind of have to walk them through some of the things. Don't tell them I said that, but we have to walk them through some of their healthcare, appointments and things like that. So how, that option of face-to-face versus virtual, are there other ways that you're supporting, folks who don't have that tech savviness?
Yeah, I think, again, we got to meet consumers where they're at, and not just consumers. We got to meet communities where they're at. And I joked in the beginning, I grew up in rural Oregon. When you think about these, especially these outlying communities that are really important to the makeup and the DNA of this great state, those hospitals are critical. Those providers in those communities are absolutely critical. They don't want to do all this crazy digital interaction and EMR connectivity and all the stuff that that we know helps in population health. We know that that's going to be the future in healthcare. They don't have the scale right now, especially coming out of a pandemic where they're stressed. There was a lot of delay in care, a lot of stress in their system in general financially. So we got to be really cognizant that we don't come out with all this cool technology and say like it's either going to participate or you're not going to participate. And so going back to where, care is really unique. We got to keep it in the community. We got to reinforce those organizations and hospital systems that provide care that probably are going to be well behind this technology evolution for several years. And that's fine. But we got to make sure that we have options for how we keep people engaged, and hopefully continue to move that transformation as quickly as we can while supporting them.
That's great. Well, so there's a lot of technologists on these conversations, and Oregon has a lot of healthcare startups, and we also have, we have Amazon and Apple and Google. If you were a part of a startup today, where would you choose to focus? What are some things that might be lacking?
There's a lot of stuff that's lacking from a tech perspective. I think there's going to be a lot of changes that come out with transparency. I know some of it's being fought in the federal courts right now, but as more transparency hits healthcare, I think it's going to allow technology companies to deliver a value prop much quicker. I think that's been a part of the challenge. I know when Berkshire and Amazon, I can't even remember the name that they created a couple of years ago when they tried to come together and attack this healthcare problem. It is such an old school, ambiguous, broken system that it was even a challenge for them to figure out how to break into it to a degree. And I think what the Amazons have figured out is that they figured this out a long time ago. If you focus on the consumer and creating the right consumer experience in terms of their end-to-end need, that you're flexible, that you meet them where they're at, and you can do that in healthcare as well, that's where you need to focus. And I think we're seeing them pivot a little bit around their PBM growth and what they want to do in that space, because they know that's easy for them to create a consumer value prop because they're already delivering stuff to them anyway. Their care at home models, because they know they're already delivering stuff to their homes and people like that. They like having services in their homes. So why not do care in the home as well? But at the same time, those are very point specific solutions right now. Again, I think where we're going as an enterprise and where the real value is going to be is that end-to-end consumer experience that allows us to really use technology and information to eliminate things like the prior authorization, or eliminate the rubs around a prescription being covered, or to make sure that when you go into the doctor, you know exactly what your cost is going to be every single time. Those sound simple. They're incredibly complex in today's environment. And a part of that complexity is led by the fact that we don't necessarily operate in the best transparent type marketplace. And so I would keep an eye towards transparency and what the transparency allows you to do in terms of tapping into the continuum, to really figure out how you can build a better either piece of that continuum in terms of the consumer experience. I think that's where the fit would be if I was focused on it.
Hey, Eric and Gary, this is Skip. Gary, one question that I have as we kind of round out here is, you've talked a lot about sort of the role of technology and platforms and kind of being more of a patient-centric organization. I was wondering if you could comment as well on sort of the importance of kind of the culture and the people part of that equation in trying to create a more patient-centric organization delivering kind of superlative care.
Yeah, that's an amazing question. So a couple things. I would tell you, we've changed. I think part of it, the change that we had as an enterprise, is when we went to a local market. decision-making process versus this national strategy, because it allowed us to be more flexible. It allowed us to be a better partner to the constituents in our local communities. It allowed us to listen better. Large companies typically don't listen very well, and they listen really, really well when all the local market CEOs are barking at them around what we need to do to provide better care at a local level. I would also tell you that this growth of Optum, and especially Optum Care, has really created, I wouldn't say necessarily like a softer side, but a much more compassionate side to our business, to our people, to our engagements. And what I would say was a real focus on this mission of creating a better system that works better for everyone. Because you think about the work they do, they're doctors, they're physicians. I have to work with them the same way I have to work with other parts of the healthcare space. And we really got into what I would say is better discussions about, you know, if Optum is creating a better healthcare environment, that environment not only benefits me at UnitedHealthcare and the groups that do business with us, that benefits the Regencies of the world, the Pacific Sources of the world. It benefits everybody. And so how can we move away from more of what I would say is a headbutting around, you know, better rates and better relationship and all that stuff, and really say, okay, how do we continue to focus on making this system better and making sure we invest in the right thing? So when that Optum Care doc is seeing a member, and it might not be my member, it might be somebody else's member, but when they're seeing that patient, that we know they're providing the best care possible, they have the most technology-driven discussion that they can have, because this great organization and United Health Group is providing amazing data and information, and we really can make sure that we're reinforcing that cutting edge care. And so I would tell you that we've changed dramatically, and a part of it's been, again, when you're working with physician organizations that are now a part of your enterprise, and you see in real time how important it is to make sure that we're propping up those types of organizations to meet the community need, and do it in a very compassionate way. It's been a big transition for our enterprise, but it's been a fantastic one.
Yeah, one more question, I think, here to wrap this thing up. But talent and workforce development is a big issue for all companies, and I assume yours as well. How do you find success in either recruiting or upskilling your talent, and how are you addressing that?
Yeah, I've learned a long time ago to hire the smartest people you can find. And that's essentially what I do, is I hire really smart people and I try to stay out of their way. And the great thing about working in such a large organization is that we have so many constituents that we can pull from across the country. We also have the unique opportunity to pull talent from other businesses. So we're starting to have this interesting migration that's happening between people that have worked at UnitedHealthcare side that go work in the Optum side, or the Optum side comes and works in the UnitedHealthcare side. And so this exchange of really rich ideas and information is really helping propel us from a talent profile perspective in a much different way. Now, I'm sure my challenges are like everyone else's challenges right now. We could always use more people, especially people that understand our business. You know, there's been a lot of rapid expansion as these IPOs launched to really pull in and acquire talent. And so we've dealt with some of those issues, but for the most part, we came through the back half of this pandemic, I would tell you, much stronger as a team. And again, it's because I honestly don't know where I would be at as a leader going through the pandemic if we didn't have the talent that I have working for me, because they've knocked it out of the park. So.
Well, thank you, Eric, for leading this conversation, and of course, Gary, for sharing your insights. We had a really robust conversation going on in chat, a lot of questions from participants. And a big thank you, Eric and JLL and team, for supporting this series as well. Want to mention everyone too, thanks for spending your time with us this morning. And we'll also have some more programming coming up later today. The next one's at about 11:30, and we hope to see you then. Thank you so much.
Thank you.
Thanks, Gary.